Dr. Johnson, I think Dr. Jones mentioned a number of historical black institutions, and I'd like to talk about historical black institutions, medical institutions, and some of the things that they're doing. Why don't you give us some information in reference to Meharry and the service that it is rendering, not only throughout the state of Tennessee, but elsewhere, dealing with some of the problems that we've already addressed here.
Well, you probably know that Meharry has been responsible for graduating at least 40% of the practicing black physicians in this country, and perhaps almost 50% of the practicing dentists in the country. I had wanted to comment on we think of Meharry readily in terms of producing physicians and producing dentists, but not too often do we think of its newer function of graduating PhDs in the biomedical sciences. And I just want to make a comment about the relative importance of that function of Meharry. In the entire country, all of the graduate schools in the country, perhaps no more than 35 or 40 African Americans receive a PhD in the biomedical science in a given year. When you consider that, and consider that Meharry on occasion will graduate 2, 3, or 4 individuals in these areas, you can recognize that that is an extremely significant contribution to the total pool of African Americans who graduate in a given year. I certainly am altogether in favor of affirmative action, but I think that one needs to point out that affirmative action, in the absence of efforts aimed at expanding the pool of biomedical sciences, leaves African Americans somewhat in the hole, and that what happens has been that the number has stayed relatively stable. The opportunities have expanded, so that what has happened has been that people play what I call a game of academic musical chairs. You know, 1 year institution X has this number, and then they raise the benefits and they recruit half of these over here, but the overall pool remains the same. So that we need to have increased emphasis on having larger numbers to be available to teach at the historically black colleges, so that they can serve as role models, so that they can help also to identify those diseases which affect our constituency primarily.
Very good. Dr. Jones, you also, I think in a newspaper article that I read quite recently, you also indicated, as Dr. Johnson indicated just a minute ago, that there has been an increase in the research at Meharry over the last several years. And why don't you give us some information relative to that, and the amount of money that is coming into that institution now in terms of research compared to how it was several years ago?
Well, historically, we were not, we did not place much emphasis on research. There were pockets of individuals who out of their own initiatives and desires, and Dr. Johnson included, maintain active research laboratories, but was not really a major thrust of the institution until some few years, beginning in the late 1960s and onward. Since 1982, we've moved from a position of just under $2 or $3 million in funded research to a level of $6 or $7 million now. Much of that research is focused in some areas that and on diseases that disproportionately impact on blacks. For example, we have one of the only funded sickle cell centers at black institutions, and we've had sickle cell research at Meharry for quite some time. In fact, Dr. Johnson was responsible for getting the first sickle cell grant and developing the sickle cell program there, and that has continued. We have the state contract for sickle cell screening at Meharry now as well. We have developed a unit, a neuroscience unit now, to focus on some diseases that are very common, Alzheimer's disease and other neurological defects. So we have emphasized research heavily over the last few years, and we've developed fairly rapidly in that area.
Very good. Dr. Johnson, there are also some other areas that we ought to talk about, and I say that primarily because quite recently we had the director for the Metro Health Department on this show, and she talked about some of the problems that she's having dealing with public health in Nashville. And I'd like to follow that up by raising some of the same questions with you about the homeless problem. I mean, what are we doing as medical institutions to deal with the homeless problem, because quite a bit of the homelessness is somehow worked into medicine.
I'm not certain that we're doing anything particular or specific with reference to the homeless in our medical school. I think of the homeless problem primarily in terms of the way the community relates to the homeless. In this country, we're often sort of prisoners of words, prisoners of phrases, and we talk of the homeless and we talk of them as though it's an homologous group of people. And some people say things like, you know, people who are homeless want to be there, you know, they don't have any ambition. Homeless is probably one of the most heterogeneous groupings that we're going to find in society. And I think one has to look at the different kinds of things that make people homeless in order to come up with a comprehensive and a responsible problem to deal with the homeless. For example, a significant portion of the homeless has to be the direct result of some of our so-called forward activities. With the mentally ill, back in the 60s, that we came up with a forward concept of taking mentally ill people out of the institutions and providing them with some areas for succor, like the community mental health center. We had them funded. But as soon as we got them out of the institutions and put them in the community mental health centers, then we took the funding away from them. And the support system was out there. So that in a very real sense, we and our responsible government are responsible for a significant portion of those people who are homeless today.
Very good. Dr. Jones, anything to add to?
Well, no, I'd like to take off on a little different subject now, but it does relate to the homeless and the things that Dr. Johnson has mentioned, and that is the need for more black physicians, physicians who are going to practice in the black community. That is a national need and is a problem which we are attempting to address by recruiting individuals who are more apt to return to their home environments to deliver care. That Meharry has done historically and continues to do, and it's something that addresses an increasing need. Many times you hear people talk about doctor surplus, but it's a matter of distribution, and there's never been a surplus of black physicians, and I don't see that nowhere on the future horizon. There is a serious need for more black physicians, and for those who are going to practice in areas of need where the underserved exist and are not receiving adequate services. In that sense, Meharry graduates continue to deliver health care to the homeless and the downtrodden and underserved. And we do that somewhat in this community by physicians who are involved with the missions and various programs. But I wanted to emphasize that historical role that Meharry is playing in health care delivery. And it really has a national impact.
I think this sort of will